Hello, my name is Pam. I'll be your nurse today. Would you state your name
Larry Hall,
and your date of birth?
3/8/46.
Okay. And Mr. Hall, I see you don't have any IV access. If you did, I would check to see if you had fluids, if it was hep locked, or if I checked the site for any swelling, or and what type and size IV it was. Now, Mr. Hall, I'd like to check your skin, and I'll let you know as I'm giving you a full body assessment what I'll be doing as I go along, and then I'll be documenting my findings. Okay, I notice that the color of your skin is normal for your race. It's got a pink undertone. The skin that is exposed to the sun does have suntan. It feels warm to the touch. There's good skin turgor. And Mr. Hall, I know that you are not bedridden, but I would have you turn to your side, and I'd check your coccyx area, your pressure areas to see if there were decubitus under your knees and heels, and of course there is none. I don't see any abnormal piercings, tattoos, or any lesions. Okay, Mr. Hall, you don't have any surgical wounds for me to check today. If you did, I would check to see if there was any drainage and if there needed to be any reinforcement of the dressing, or if the drains were activated properly. Now, Mr. Hall, I'd like to check your respiratory system, and I have been observing you, and your respiratory rate is 12. I see you have no airway device. Earlier I checked your O2 sats and found that you're breathing at 98% on room air. You have an unlabored breathing pattern. And Mr. Hall, do you have a cough of any kind? Okay. And there's no distress noted. And Mr. Hall, I'd like to take a listen to your lungs. If you would just take a deep breath each time I move the stethoscope. All right, take a deep breath in. And again. That's good. If you would sit up for me just a second. Okay, again. All right, one more time. All right, everything sounds clear. And of course, we're not receiving any oxygen of any kind. And Mr. Hall, I'd like to check your cardiovascular system now. And earlier I checked your blood pressure. It was 120/80. And I'd like to check your capillary refill, and that is less than 3 seconds. Okay, now we have no swelling or edema in your extremities. And Mr. Hall, do you have a pacemaker?
No.
And have you ever had any dialysis? No. Okay. All right, so we will not need to check a fistula. And Mr. Hall, I'm going to check your jugular veins. There's no distension. And now I'd like to listen to your heart rate. Mr. Hall, I'm going to listen for 30 seconds. And then I'll just multiply that by 2, and your heart rate is 60. It was regular. Okay. I heard no murmurs, gallops. Okay. Now, Mr. Hall, I'd like to ask you about your gastrointestinal system. What was the date of your last bowel movement?
This one.
Okay. And now there's no ostomy of any kind. And Mr. Hall, do you have any complaints with your bowel movements of blood or any pain, any constipation? Okay. Any problem with your, no problem with diarrhea? Okay, I'm going to listen to your stomach now, Mr. Hall. And I'll just listen in your 4 quadrants. All right, you have hyperactive sounds. And your abdomen feels soft. There's no distension. All right, do you have any trouble swallowing, chewing, anything like that? Okay. Now, Mr. Hall, I'd like to ask you about your urinary system. And now, are you having any trouble with retention or urgency or anything like that when you're urinating? Okay. Now, when you're with your urine, is it like a light yellow color normally? Okay. There are no tubes, no Foley's present, no bleeding or pain when you urinate. Okay. Now, I'd like to talk to you about your neuromuscular system. Of course, your level of consciousness, you're awake, alert, oriented, and you certainly understand all of the questions and you're able to answer any complex questions. Now, any numbness or tingling with any of your extremities? Okay. I'd like to check your pupils. And what I'm going to do is cut this light off, and if you'll just look straight ahead, I'll shine this light and check your pupils, and yes, and they are constricting, and if you'll look, all right, and they are equally constricting and reacting to the light. Okay, now, Mr. Hall, you don't have any braces that you've needed, and also I noticed that you have no problem with your gait when you walked in, but now you have had trouble with your rotator cuff. Now, I want to ask you about that. Would you show me what causes pain with that arm? Okay, movement that way? Okay. All right, and then that causes pain. All right, Mr. Hall, let me see this if there's equal strength. I do see equal strength with both. If you'll push against my hands, equal strength with the feet. Are you able to lift your arms up and set them down? And lift your feet up and lay them down? That's correct. Thank you. All right, Mr. Hall, in our interview today, in our exam, I see that you have been cooperative and calm and helpful, courteous, and your appearance is age appropriate and correct for the season. In your thought process, you understand the questions, you answer appropriately. You understand your illness. You know why you came to the doctor. You understand about your rotator cuff and its problems. You have family that came with you that are in the waiting room. You're able to communicate with no problems, and you've been pleasant throughout the entire exam. And thank you very much.